Oh yeah, I just wanted to know, like, do you really think the empty nose syndrome is a big concern? Like, I feel like just not touching this, because I actually don't really have that many sinus issues at all or allergies. I'm terrified to like fix my deviated septum and, complicate my life.
I would fix it with an MSE, and that way you don't have the risk of getting the empty nose syndrome.
Right. Yeah.
You can use an MSE to treat nasal breathing obstruction.
Because I noticed too, like if I go, I'm like, oh, the mic, but if I go like this, so much
Helps.
easier.
MSE all day.
Yeah.
100%. You could kill two birds with one stone. You could give yourself a little bit of oral volume for your tongue and solve your deviated septum issue. I'm not saying it's going to cure your deviated septum,
Right.
but I'm saying it will alleviate the symptoms of the deviated septum, which, if you can breathe through your nose, who gives a shit if you have a deviated septum?
Right. Yeah. And the MSC, I could continue my life, right? Like besides maybe the first day it's painful or.
First couple days.
Yeah.
Yeah, MSE, no one's even going to know you have it.
Yeah. Cool.
Because it sits at the back of the roof of your mouth.
Yeah.
Like it sits like here.
Yeah.
So it doesn't super interfere with your talking, maybe a little bit, but it's really when there's appliances in this area that you talk super funny. But the MSE's back here, so it's kind of unintrusive, I would say, as far as orthodontic appliances go.
Yeah. Yeah. All right.
Something to talk to Dr. Nuaz
Yeah.
about. He could definitely hook you up with an MSE. And as a fence case, as I said in my video for fence cases, you want to be moderate with your expansion.
I think, to be honest, I'm probably going to look into the night guard first and see how I do. And then just kind of have him, like, on dial. And then if I need the MSC, I already have the connection with him and I already spoke to him. And then I could pursue it further. But yeah.
Yeah.
I didn't want to do a double jaw surgery. So that was going to be a nightmare.
No, and I'm definitely not pushing MSE on you, only with regards to your nasal obstruction.
Yeah.
And I would just say do an MSE before doing some sort of soft tissue nasal surgery.
Of course. Yeah. Yeah.
That way you don't have to worry about ENS.
Yeah. Yeah. Because that terrifies me because
Me too.
I think Michael Jackson died of that. Like, I think there's a lot of evidence.
Maybe.
Huh?
Why? Did he have
Oh, you
like
didn't
nasal
hear about
discomfort
this?
that was driving him crazy?
Okay, no, you got to look it up on YouTube. Like, there is literally at his court case, there's a doctor who testified that he had empty nose syndrome. And that's one of the reasons why he needed so many medications to sleep at night. And I think it was driving him crazy. And I think that's why he ended up overdosing. And a lot of people with empty nose syndrome want to kill themselves. And it's like, I don't want to kill myself right now. So anything's better than that, Like, that's literally the worst.
Wow. Did Michael get that from all of his cosmetic
Yeah, they were saying all the
enhancement on his
cosmetic
nose?
procedures.